And so I really want to encourage people to take the precautions that they need to take against mosquito-borne illnesses, specifically avoid prime feeding times, dusk and dawn, wear repellent, and wear long sleeves and pants to decrease the exposure of your skin to mosquito-borne illness. In general, West Nile virus is a self-limited illness. However, when we have neuroinvasive cases of West Nile, it really is an indicator to us to make sure that we're getting the message out that people should be careful. Both of the individuals who have had, who've been identified with neuroinvasive West Nile virus live in the southeast Vinton area, and so we particularly urge caution in that area. So at this point, I'll open it up to any questions that you may have. So who should get so there's a question from Jean, who should get the Omicron specific new booster shot, even if you've had shots already? Are there age limits to eligibility for the new booster shot? So Jean, thanks so much for bringing that up. I think last time we met, we were anticipating the FDA and ACIP approval of the bivalent booster shot. So it's actually fairly straightforward. The monovalent, the one strain shot is available for people who have not yet had their primary series. So if you haven't had your first round of COVID vaccines, the monovalent, the one strain or one variant shot is the shot for you. However, everybody else, regardless of how many boosters you've had, if it's been more than 2 months since your last COVID shot, you are eligible for the bivalent booster. And what I mean by bivalent is just like in flu, in our flu shots, we have different variants of the flu vaccine, different variants of the flu virus, protection against those in the vaccine. This new booster has 2 different strains or variants that it's protective against. The original strain and then B4-5, which are the predominant circulating strains, or variants. So I certainly encourage anyone who has been vaccinated and it's been more than 2 weeks to go ahead and get their booster. We're particularly interested in making sure that our elderly population and our population of people who are immunocompromised or who have chronic medical conditions take us up on getting that booster shot. So hopefully that's helpful. A quick nuance, I'm not sure if how important this is to our viewers, but Pfizer is available, the bivalent Pfizer is available for anyone above the age of 12, and Moderna bivalent vaccine is available for anyone above the age of 18. So hopefully.
Hi, Dr. Morrow.
Oh, yeah, Leanne, sorry.
Hi, good morning. I wanted to go back to the West Nile case. You had mentioned it's the second so far in the last couple of weeks. For context, could you tell us typically in a typical year how many West Nile cases that your health district would record? And can you also clarify what you mean by neuroinvasive?
Sure, absolutely. So typically, we haven't actually seen human West Nile for several years. I believe that our last case of West Nile virus, reported West Nile virus, was in 2018. And we may see one, prior to that, we might see 1 or 2 cases per year. So this is pretty, they're not high numbers, but it's pretty unusual. And that's one of the reasons why we want to make sure that everyone knows to protect themselves against mosquito bites. Neuroinvasive means, so West Nile, like many other viruses, can cause a wide range of symptoms. A lot of people who have West Nile don't even know that they have it. And then there's some people who get it who might have what we call viral illness. So they might have fevers and body aches. But unfortunately, a small percentage of people who get West Nile virus can actually get inflammation of the meninges, so meningitis associated with it, and even encephalitis. So that's inflammation of the brain or inflammation of the lining of the meninges, the spinal cord. And so it's, when we talk about neuroinvasive, it means that it's gotten into their central nervous system. And typically speaking, we're we would think of someone who might who might have what we call viral meningitis. But then when we do the studies, we find out that it's actually because of a specific virus, and that's West Nile virus. So these are individuals who may present with severe headache, neck pain, or even altered mental status. And the severity, of course, is much higher if that virus has invaded your central nervous system. So I hope that answers both of your questions, Leanne.
Yes, it does. And to follow up on that, since the health district was able to determine where those cases particularly came from, is there anything that the health district can do or will do to mitigate potentially any environmental factors that could contribute to the spread of this virus?
Yes. So historically, there have been cases around a specific facility, and we are working with that facility. We've been in contact with them over the last few weeks to review what they're doing to decrease water, to decrease the exposure. We're talking with them about different options to decrease the risk. Now, I think it's really important. I cannot emphasize enough that we don't know what the source is. There's historical precedents, and I believe that this was covered in the past, that the sewage treatment plant may have been a source. I do not know that at this time. I have asked to see if we can get some, and this is premature, but I have asked to see if it's possible to do some more mosquito surveillance in the area, and that would be with the support of central office. So I don't know whether we'll be able to do that. We know that there is something that we can all do, and that's to protect ourselves. So it is important for us to look at how we can try to mitigate any environmental factors, and we have been working with this facility to see what they can do. They've been very responsive, working with us, but it's hard because we don't have the mosquitoes to prove it. We don't have the QLEX, the testing, and so we're seeing if there's a possibility of getting any support to do mosquito surveillance. It's a bit complicated. There are a lot of moving factors, but I want to focus on what we can do. What we can do is protect ourselves against mosquito bites. And certainly, if you know of any standing water in your own property, do what you can. So knock over those bird baths, whatever you can do to minimize standing water, which is where mosquitoes breed, would be really helpful. So there's a question about missed the update. Should those be concerned now that there's one confirmed death correlated with monkeypox? So sorry, I think the monkeypox numbers. We did review the monkeypox numbers. We're up one case since our last report. I think that it's really important for us to put monkeypox in perspective. One, the good news is that across the country and across the state, the trajectory seems to be decreasing. We don't seem to be having, the number of cases is slowing. Now, that doesn't mean that we're out of the woods, but I think that all of us are hopeful that between the vaccination efforts and all the public education, all the support that you guys have provided in making sure that people know what they can do to protect themselves against monkeypox, we are seeing what looks to be the downside of a bell curve. So hopefully on the other side of this outbreak of monkeypox. It is always important to keep things in mind that overwhelmingly individuals who have monkeypox, this is not a severe illness, and there are always going to be outliers, but that shouldn't change the overwhelming data that support that this is a mild self-limited illness. And we want to continue to do whatever we can to prevent the transmission of monkeypox. We continue to encourage people to come to our clinics to get vaccinated if they're eligible for vaccine, and certainly to decrease the risk of high-risk sexual behaviors where most of the transmission appears to be occurring. Okay, you're welcome. Any other questions, Leanne? I hope that I answered all of your questions about West Nile virus. We've talked about monkeypox. Any other questions that you may have?
I know it's really hard. Like you always say, Dr. Moore, we're constantly humbled by COVID and its twists and turns that it throws us. With this new bivalent booster, I guess my first question is, since it's become available, do you have any data on the uptake of it so far, and what kind of impact do you think that the availability of this booster might have for us in the fall and winter season, as we head into the colder months and the holidays?
Those are great questions. In terms of the demand, we're not seeing a huge demand. We were fortunate that we had a team at the Salem Fair this weekend, and we were able to vaccinate, I believe it was about 70, 80 people with the bivalent booster. So that was very exciting. But there hasn't been a huge demand. We are offering it, and Christy, I think you can share our plans for our vaccine clinics. We are offering the bivalent wherever we give vaccines. So certainly anyone can contact us if they want to get vaccinated. It's also available at pharmacies and at some primary care provider offices. So I think that with everything, we can't predict. I hope that a lot of people take this booster. One thing that we haven't had prior to this, we've been playing catch up, right? The variants are ahead of us. Right now, we know that the primary circulating strain is B5. That is the overwhelming circulating strain. And we know that this vaccine provides coverage for that particular strain. So I'm really hopeful that people hear the news that we have a vaccine that covers the strain that is currently circulating. And if people get their booster shots, then hopefully we can continue to see a downward trend. But as you said, we've been humbled by this virus for the past 2.5 years. So I expect we'll continue to be humbled by it.
Thank you, Dr. Moore.
You're welcome. Thank you. Any other questions? All right.
All right, well, hearing none, thank you all very much for joining us. And with regard to where people can find doses, we are encouraging people to look at pharmacies. Many of the local pharmacies are carrying it and have had it even longer than we have. We do have some clinics, and an update to you, Dr. Morrow, apparently the phones have been ringing quite a bit today. So I think the switch has flipped and the interest has picked up. So our clinics this week may become fully subscribed, but we certainly don't anticipate any problems with replenishing supplies as the weeks go on. So to have them try again, because we will definitely be able to have the resources to get them vaccinated, and so will local pharmacies and doctors' offices. So thank you all again. Have a good day.
Bye-bye.